we're going to do PPE and double bagging. Um, of course, we're going to apply body mechanics, safety, privacy, and all that. Introduce ourselves, ideally after having all the PPE on, because otherwise it defeats the purpose of it, which is protection. And there's different types of purposes for this, for the PPE. Isolation, one of those, contact isolation, which we use the gown, the gloves. There's also droplet, we use the mask, we use N95 for airborne. So let's get this started. I'm gonna wash my hands first, so I make sure that they're clean and they are dry. And I'm also gonna assess the need of the PPE, what it's for, like I mentioned, and the availability, because I might need something that is not there, so I need to go get it, or improvise. But ideally, I have everything. We're gonna start with the gown. The gown usually comes either folded in a bag, or depending on the type of gown, because there's disposable ones like this one, there's plastic ones, and there's reusable ones. But basically the idea is to let it open, grab it by the shoulders, and then put it on without kind of touching, well, this is backwards, but without touching the outside of it, but put it on this way. I guess it doesn't matter if you touch the outside, and then tie it. Okay, the important ties are these, because we don't want to go to the front. We just want to tie it in the back. In case we need double, if the gown is not covering the back, we need two gowns. We put the back one first, like any other one, and then this one, and it covers, and the ties are on the back. And then we are going to put a mask on. So the mask comes with a little wire here, and goes this way. So the little wire has to cover our noses, and the way I test it is, because I wear glasses, so if my glasses are fogging up, then it's not right. But if they're not, then it's right. And then we pull it down, we cover the chin, and then we tie it in the back. And next we are going to put the headpiece. Now there's different types of masks. There's some that it's just like the ears that you put on your ears this way. So oh, before the head cover, goggles or face shield in case we need some. So goggles, there's some that you can put on the glasses in case you wear glasses, and there's some that is just a face shield that also has the wire that you have to adjust on the bridge of your nose, but they all the time they go on top of the mask. That is the important thing to mention. This one, the cover the ears. The idea is to cover as much as possible, no skin or anything exposed. And of course, the gown is not supposed to touch the floor, the little ties. So I didn't mention it, but the shoe covers, so all covered up. And the last thing is the gloves, which again, we make sure that they're over the sleeves, so that is covered. And then we put these on. Okay. So that is covered. This is the way it's on. Now, we are in a room where, of course, part of the assessment is because we're going to come in touch with bodily fluids like stool, blood, I don't know, sputum, etc. It's supposed to be sweat is excluded, but I wouldn't exclude it. I still don't want to touch it, don't want to be exposed to that. And I'm going to put everything in this biohazard bag. And this is a double bagging. You need two people, one on the inside, one on the outside. This one is going to be properly tied and making sure that nothing is spilling. And then the other person is going to fold the edges of the bag over his or her hand, and I'm going to deposit the bag inside, ideally without touching it because I'm wearing the gloves, and just deposit it inside the other bag. Just drop it in there gently, and the other person is going to fold it, close it, label it if it doesn't say biohazard or whatever, and dispose of it in the appropriate receptacle. Now, to take this off, ideally is the gloves, or usually the gloves come off first, unless this is a disposable, like the plastic disposable gown, which in that case you pull, and with your gloves on, you pull, and then everything comes off. In this case, I'm going to take these off, and so the way I do it is I pinch and then pull. So the glove is inside out, and then here, slip it, and then that is also inside out. I can pull. So that is, and then I dispose of it in the appropriate receptacle. And now I'm going to take my gown off. So I untie it. I can wash my hands if I'm in the patient's room, wash my hands or use the alcohol or whatever. And then this one, the first one is the waist. I untie it. I don't touch the outside of it, but I untie it. And then the top one, untie it and let it drop. Or from the inside out, pull. So it's this way, and then dispose of it. If it's a recyclable one container. If it's not, then in the garbage. And then the hair cover, which I slip my fingers like that, take it off and dispose of it. And then the mask, which in this case didn't stay tied, but the first thing I'm going to untie is the bottom one and then the top one. If I have the goggles, they would come off also after the gown. And all right, so the mask, I would take it off. Oops. So in this case, that is touching everything. I would wash this, dispose of that, wash my hands, disinfect before anything else, put them back on. Now we're back in business. And then take the shoe covers off and dispose of them. And, well, again, wash my hands. Make sure the patient is okay with Colate and everything before taking everything off. Wash my hands and leave the room. And that's it.